STEM Talks, connecting communities globally.
We all know that STEM empowers individuals with the skills to succeed and adapt to increasing complex, changing, and technological world. Welcome, everybody. I'm Pratima Penumarthy, founder and director of Arya Math Academy online tutoring program. Arya Math Academy, in collaboration with Stravio, proudly presents STEM Talks connecting communities globally. I would like to introduce you to fascinating people who passionately inhabit scientific and technical frontiers of our society. It's with tremendous pleasure that I welcome you all to our second STEM Talk episode. Today's STEM Talk is with Dr. Lakshmi Thalanki, who's an associate professor in Department of Orthodontics at Boston University. She graduated from Boston University School of Dental Medicine with a residency in Orthodontics and Dentofacial Orthopedics while receiving a certificate of advanced graduate studies and Master of Science in Dentistry. Dr. Lakshmi is a very successful private practitioner owning 2 exclusive orthodontic practices in the greater Boston area. She has exceptional clinical experiences in the fields of orthodontics, and I believe it's definitely more than 16 years. Dr. Lakshmi is actively involved in Massachusetts Dental Society and has held many positions since 2001. She was also the chair of the Women Dental Conference in 2010 from the Yankee Dental Congress. And she has been recognized with several awards from Massachusetts Dental Society, including 10 under 10, Leadership Institute, etc. So many other things, so many accolades for Dr. Lakshmi. She has given several lectures and scientific presentations nationally and internationally all over, I think, many years. Dr. Lakshmi has great research experience and was also selected for the prestigious Hatton Award for her research from International Association for Dental Research, IADR. She has published several articles in various journals and publications. Dr. Lakshmi, she lives in Boston, enjoys hiking, and she loves traveling with her family and friends. So welcome, Dr. Lakshmi.
Thank you so much, Pratima, for having us.
Dr. Lakshmi, this is a very formal chat that I'm going to have with you today because this conversation is basically for many high schoolers and their parents would love to know how their children, should get back and, choose their careers eventually when they try to, go to their undergrads. So Dr. Lakshmi, when did you decide to become an orthodontist and why?
I decided that when I was very young, when I was like 10 years old, when my mom had to go through the emergency appendectomy procedure, and that whole incident had a huge impact on me. And then I even told the surgeon that one day I'm going to be a doctor. And he was so impressed that when he saw a little kid being so impressed by what happened, even though, it was not something expected and a nice surprise. So he was very, very passionate, and he spoke to me about, about his work and how things are and how he feels so good about making a difference in people. So all those experiences made me feel like, oh, this is such a noble profession. I really want to be a doctor one day so I can help so many people. And when the time came, when I was in high school in India, like when you have math and science, you have a choice in so many different fields. You get to choose. You don't have to make a narrow down the choices like here. So I was fortunate enough to get into engineering, medicine, dentistry. So then I had to get and choose which one I want to be. And I always, until that particular time, I wanted to go into medicine because I didn't know anything about dentistry at that point. I should say, as a patient, I knew, the dental treatment wise, and everything was fine and nice, but it never really had the experience or exposure to dentistry. Many times in India and even here, a lot of people are not aware of that field so much as a career choice. So my uncle, who was a primary care physician, he's my mom's younger brother, And he was the one who was very instrumental in explaining it to me about what dentistry is all about. And he, in fact, took time off from his practice and took me to his friend's place. And he was he's almost like the same contemporary, like a classmate of his. So they both kind of graduated at the same time, and they both had, like equal career opportunities to speak time-wise. So, and then he compared his life to his friend's life and said, look, he works so little hours compared to me, because my uncle was working almost like 80 hours, which most doctors do in anywhere in the world. They do work a lot. So, and also he was comparing, like all the benefits and how you could balance your lifestyle and family and career. So he was the one who encouraged me to consider dentistry. So I'm very happy and thankful that I had that, because even though when I had a choice, many times I really didn't know what each career is all about, because many times you just go with the passion or whatever little knowledge,
yes,
exposure you have. So my advice to the high schoolers is, any profession you want to consider, anything, please go and shadow that person, or all the choices you may consider. Because sometimes what you read and what you know may not be exactly what it is in daily life. Some people think, oh, it's all about biology, it's biology. But, it's once you graduate, I don't know the whole Krebs cycle, even though I learned like a million times. So you don't go to that molecular biology all the time in your career. So
right.
your career will be so much more different than what people consider. Many high schoolers think, oh, it's based on the basic subjects, what they are inclined or interested, that they make a career choice. So I feel sometimes they need to go outside that book and shadow the person whom they want to be, and see how it is to be that full-time doing that same thing.
Absolutely. Another thing is that Dr. Lakshmi, I know a lot of, because I interact with so many high schoolers, initially when they ask a question, even though they will know it, once they start doing more research, what according to you is the main, just to tell the high schoolers, the difference between orthodontist and a dentist. And I know that a lot of people are also want to know, what's the difference between orthodontist and the periodontist. And sometimes they even get confused, like, oh, then what is oral surgeon? And then what is orthodontist?
Yeah. I would say orthodontics is just a branch of dentistry. It's a specialization where we focus mostly on irregularities, fixing the irregularities of the teeth and the jaws to line up and make it more harmonious to your face. And sometimes it does involve doing surgery if the patient has neglected the problem for a long time and the growth period is over. Then you may have to do braces and jaw surgery to fix it. And sometimes, if you are fortunate that you were exposed to the treatment and got a good treatment earlier on, then you can prevent all those complicated treatment in the future. So then we do growth remodifications and we make use of the growth phase and try to make them grow in a more harmonious way. That's why it's called dentofacial orthopedics. That means we do control the jaws to some extent to do some growth remodifications to get like a lot more results. But once the growth phase is over, unfortunately, we won't be able to harness the growth potential of the kids. So that's about orthodontics. And different specialties like periodontics is all about gums and gum-related surgeries and bone and health of the periodontium, that is the gums and the bone surrounding the teeth. And oral surgery obviously involves more surgical in the oral cavity, and to some extent they also do plastics like rhino, like the nose. To some extent they work in collaboration with other plastic surgeons, and also the chin. And many times in the cancer treatment, they do a lot of block dissection of the neck and stuff like that too. So they all work together as a team. And in cleft lip and palate, they also do a lot more, oral surgeons. And orthodontists and plastics and general surgeon, they work as a team.
Oh, they do. Okay. So as I just heard from you, Dr. Lakshmi, is that orthodontists, they examine, they diagnose, and they also treat the dental, the malocclusions and in the different oral cavity anomalies, what you were telling now. So for fabricating these appliances to realign teeth and the jaws, these are special tools. Of course, you must be using special tools. And is there any special technology that basically use in this entire process?
Yeah, we have a lot of tools. It's more like dentistry in general has a lot of tools in it. So you're more like an artistic and scientific combined together. That's why dentistry is so much more hands-on compared to medicine. Some specialization of medicine do use like, surgical or procedural driven subjects, but many of them are more like, like more mental rather than, with their hand skills. So in dentistry, you get to use your dexterity skills. So that's a very nice thing too, along with your, um, and also with orthodontics, we use a lot more different instruments. I would say every specialization in the dentistry is very unique to their own instrument. So many times, like, even though I was a general dentist before I became an orthodontist, but many of the treatment, like even to my own family members, sometimes I can't do mainly because I don't have the tools to do all of those. So it's very specific to each field. And we do have a lot of advances and coming in. And now I love the fact that so much technology is coming into medicine and dentistry. So which is amazing. Like, we have the 3D, which is like so much more better than 2D x-rays. So 2D is like, you're basically superimposing every single problem, every single layer of the problem. So you only kind of speculate how big or how it was. But now it is very nice to see that in 3D, it's so much more clearer. It's almost like going into 3 microns, 10 micron sections, depending on the exposure. So it's wonderful to see. And you can also do a lot of volumetric analysis to see how much is the airway, whether it's constricted, if there is an erupting canine, whether it's really affected the bone of the other, or resolved the roots of the other teeth. So, and if it has resolved, we can see how much. Is it only in dentin and only in enamel, or is it really that we are going to have to lose the other teeth in the future? So it really helps to get so much more information. So I love that the technology is improving and helping the patients and the doctors a lot.
Sure. And Dr. Lakshmi, we know that you had been teaching and, in Boston University. So how much of your time is spent teaching and seeing patients, doing your own research? So, change the mix if you want to, but, could you explain that more?
Sure. The teaching part, I've taken a break because of my mom's situation. She has a lot of health issues. So from, I think, 2019, I took a break. I may go back to that when the time permits for me. So I was mainly a clinician. I was mostly a private practitioner, but I did love teaching. So when I was approached to teach at the Boston University, I love bidimensional technique. That's one of the techniques of doing orthodontics. And I was very fortunate. Dr. Ginelli, he's the pioneer. He's the one who invented the technique at Boston University. So I have a passion towards that, and I really wanted to bring that back to the students at BU, because many instructors now in the program are not so trained. So that was one of my motivational factors to go back and teach, and that was what I was passionate about to teach in the ortho program. And I was doing only on the Fridays when I was not working. So, and I may continue in the future depending on the schedule. We'll see.
So, where do you see orthodontics in next 10 years?
Well, as long as people are concerned about and want to correct their teeth and smile and everything else, I do see there's a huge potential. And suddenly somebody discovers a gene for irregular teeth. We don't know if that can happen, and maybe and who knows. But until then, most of the people, like the way I see the trend, they are not using their jaw to the full potential. Like if you see prehistorical skulls, most of the teeth were lined up better because there was a lot of wear and tear. They even had space for their third molars. If you look at all those, how the evolution has taken place. So now more and more, the jaws are getting smaller and constricted because of the food choices. People are not eating so much more raw vegetables and fibrous food. So most of the jaws are becoming smaller. So I do see a huge problem there. And like anything else, if you don't use it, evolutionarily, you lose it. So the jaw sizes are definitely decreasing. So it's a very routinely, we are extracting wisdom teeth now, so much more than what it was before, because they're causing more problems and there's not enough space for them. So I see there is definitely, I don't think we can ever get rid of the whole specialization per se, and I see a huge, like software and the technology will be more integrated. That's where I see the future going.
Thank you. And Dr. Lakshmi, I know when we were in a previous conversation, just when we had a few minutes before, you were talking that orthodontists need to have very good manual dexterity since they will be working in small confined spaces in the mouth. So what other skills do they need, along as with the areas of dentistry, of course, as far as I know, like good communication skills are also vital, isn't it?
Of course, in any field for that matter. Not only orthodontics, I would say the whole dentistry in general uses a lot more of your dexterity skills. And if you don't have it, you don't have to worry about it. You are trained. You will be trained for the whole program. You'll be sit to make, multiple times until you're really good. So that's how the program is designed. So I don't want the high schoolers to shy away and say, oh, probably I don't have the skills, or I may not be a good dentist, because even if you're not the greatest in artsy, because many times the boys don't know what they have, the fine motor skills, because they've never really exposed to it, but they all turn out to be good dentists one day because the program itself trains them. So you will be trained to be a good dentist, and if you like it and you enjoy doing artwork, you will enjoy even more. But that doesn't mean everybody will not reach there one day.
Yeah. And Dr. Lakshmi, there was one of the high schooler who actually had this question, and I had actually, saved it for to ask you. And he was saying that orthodontics is largely overlooked and it's very difficult to find answers online, when they want to find. And he basically wants to, in the future, of course, become an orthodontist, but he wants to know that, when in the high school, because, because if he wants to undergrad and do undergrad degree, does he have to take a specific major, or is it like recommended that he should take biology as a general or biochemistry?
Well, I think most dental schools have already given out like what the requirements are for a pre-dental requirements, like how many credits of biology, how many credits of physics, math, and those college-wise. But majority of them, I think, pre-med program and pre-dental are pretty similar, as far as I know, with my son and my daughters going through the same track. Mm-hmm. But there are few colleges, they may have like little extra special requirements. So whichever one they are considering to apply, so they need to make sure they have those minimum credits. Otherwise, by the time they graduate and they realize they have 2 or 3 credits less in some subject than what they need. So it's always a good idea to kind of make sure in your 3rd year when you're applying and taking your DAT exam, just make sure all the requirements are met. If not, take those courses in the final year.
Okay. And also, I think it's never too early to start planning for your future career. And there are many high school students who are wondering what they can do to prepare for a career in dentistry. So could you please share with us how high school students can prepare if they want to prepare right from beginning for dental school?
Like any medical or dental, they have to be really academically good. that's like the bottom line. Like you have to have good scores, you have to have good SATs or ACTs. Like that's a given. When I was in the program and I was teaching, like I was trying to help as much as possible with browsing through the applications or any of those questions or anything like that. So it's like everyone assumes you have to be in top so and so percent in your school, and you have to have good grades. And things are after that, what people need to have is like they need to be an all-rounder. That's what everybody looks for in a college admission. That means like every part of your brain needs to be stimulated. Like if you kind of break it down into like music or artsy things, and then with math, and then community service to have empathy, and research or shadowing or any of those kinds to show that you do care and you'll be a responsible person once you graduate, and you can reach out to your community and make a difference. So most colleges look for all those, like being an all-rounder, I can say. And also in music, some people maybe with sports. So that criteria comes mostly for boys. If they are involved with sports, then they may not have that much time to be involved with many other things. So you kind of have to have, like it's very difficult to do everything with the time you have. So you have to pick and choose, and you have to be good in one rather than having multiple things you've tried but doesn't have a passion towards one. So they want to see that you stick with few good ones, whichever one they are. By high school, I think you need to kind of narrow it down to your sports or profession, or like if you're in dancing or music, like be good in whatever you decide to do.
And this is a question, Dr. Lakshmi, I wanted to ask you directly, is that could you list some reasons to consider a career in orthodontics? Because that way many students who are very interested would like to get a clear picture about it.
Yeah. See, I would say for a high schooler, they should not narrow it down to any super specialization, whatever that might be in medicine or dentistry. I feel they should just go do, if they want to do anything in dentistry, they have to do dentistry and try and be a dentist and look at all the profession and specializations that's available for them, and then see what they like to make a decision. Many times people jump and try to go somewhere, but then they may not know exactly why they even chose what they chose, because it takes a lot. Because even for me, like when I decided to be an orthodontist, that was only after I was a dentist. Once I was exposed to all the different specialities, and it changes as you get introduced to new and new rotations, and you'll be like, oh, I like this, I like that. And it's very confusing actually sometimes when you have a choice to make. So I would suggest they go into the field, whatever it is. Like if they want to decide to do dentistry itself is like a specialization, in a way. So let them just go do that and then decide what they want to be. So for me also, like when I graduated, I was torn apart between orthodontics and oral surgery, which is very weird combination for a person, because it's like two extremes. One is like so much blood and hands-on and pain and discomfort, and the other one is like you really don't see blood at all. Like it's totally different spectrums. So but that's what I liked. Like I liked one on each side. So then I went and shadowed, and I saw how it is to be an oral surgeon. And then I decided, well, this is what it is. And that's when I decided I want to be an orthodontist. And then when I came here, I had to repeat 2 more years to get my license. But by then I had already decided I want to be an ortho. So that's what I worked towards.
Thank you very much, Dr. Lakshmi, for taking time to be a part of this STEM chat and share your vast knowledge with all of us. I really appreciate your willingness to talk and educate most of the high schoolers here about the importance of orthodontics. Also, I would like to tell to all the viewers here, during this unprecedented time, even due to COVID, Dr. Lakshmi had sponsored many school teams. She had stitched masks for healthcare professionals during this PPE shortage, helped organizations like Seva International for Diwali, helping local food pantries with food donations. And honestly, I'm so truly inspired with the amount of energy she has and the inspiration that Dr. Lakshmi gives all the youngsters to launch their careers in the field of orthodontics. So Dr. Lakshmi, any advice to our audiences who are watching us today, especially high schoolers, that you would like to share?
High school is a time, is like they really have to enjoy and be very happy. Those are the things that you never get it back, even though they all are eager to graduate and go and spread their wings. But I say just enjoy, remember and cherish all your moments with your friends. It's very important. And you will look back in your life and say, oh my God, that was one of our best times. It's so, like stress-free in a way, because you don't have to worry about anything else other than being a student. And you're an adult and a student at the same time, so which doesn't happen too many times in life. So don't be in a rush to grow up, enjoy. And whatever your heart chooses, go for that. Because sometimes with the choices, there's so much confusion that happens. But I see that everybody will go back to the original choice they always made, because it's very natural to feel confused and be overwhelmed with the choices you have to make, the decisions you have to make. But don't be afraid. Don't be afraid to make all those. And I say dream big. Dream really big. Don't be afraid to dream, because many times people are like so scared to even dream, because they are like, oh my God, what if I don't succeed? I'm like, if you don't dream big, you'll never grow to your full potential. So I say, dream very big. Even if you reach halfway, you'll be better than not dreaming at all. So
absolutely. Thank you so much, everyone, for joining us and watching our STEM talk shows. Our episodes mainly focus on various STEM-related subjects, as well as careers, motivations, education, and passions. So actually, you can think of us as outlines and signs. So tune into our show, and if you like us, please write a review about our STEM talk on your YouTube channel. Please check our YouTube channel, Arya Math Academy online, and please don't forget to subscribe and spread the word. Thank you very much.